Hi everybody, in this video we're going to demonstrate a test to show the difference between capsular restriction in the hallux or big toe versus the plantar musculature causing restriction in the first toe. These restrictions can cause a faulty windlass mechanism in the foot, which can also be a major contributor to myoplantar fasciitis in the sole of the foot. So to complete the assessment of the hallux or the big toe, the first thing we're going to do in the two stages of the assessment is to passively assess the dorsiflexion of the big toe without any load bearing on it. We should, in a non-positive test, be able to have 70 degrees dorsiflexion of the big toe. If we have a restriction passively, this would indicate capsular restriction or possibly an arthritic change at the metatarsal phalangeal joint itself. We would then ask the patient to stand. We can place our index finger and or middle finger under the big toe. As they fully load on the foot, we would then try and passively dorsiflex the toe to 70 degrees. And in this case, we can see that the big toe does not lift 70 degrees. If we had a 70 degree lift, it would be a negative test again, and it would show that the musculature of the plantars are capable of allowing the dorsiflexion of the foot. And because we do not have a full dorsiflexion in this position, it's telling us that the plantar muscles are too tight and are restricting the dorsiflexion of the foot. So there we have it, guys, a nice simple test for capsular restriction versus muscular restriction causing a possible myoplantar fasciitis in the sole of the foot.